My name's Oliva. I'm a sophomore at Drexel. I'm originally from New Jersey, and I'm here as a health sciences major, health services administration minor on the PA Bridge track. What appealed to me about the physician assistant profession is the timeline of the education. So once you finish the bachelor degree, it's 2.25 years of master's. And if you're part of the Drexel Bridge track, you subtract a year. And I've always had a love for human body and anatomy, pathophysiology, and that combined with patient care and making people feel good about themselves when they're not feeling all that great is something that really appealed to me, and being a PA allows me to do that. As any student looking to go to college knows, choosing a college is hard, and it's a big decision for you, for your parents. So when I was deciding to go to Drexel, I saw that they had the PA program, the Bridge program, and I realized that's something that would really benefit me in my future. The PA Bridge program is open to health science majors. So by the end of the winter quarter of your freshman year, this leads us into March, you're able to opt into the Bridge track. So you have to have a B- in your prerequisites at least, as well as having shadowed one physician assistant. Once you're opted in, you're going through the track, you're completing all your courses, and then in April of your sophomore year is when the portal for physician assistant school opens up. You're able to apply. By this point, you'd need the 500 patient care hours, along with the appropriate GPA. And once all of that is submitted, by September 1st is the deadline, you're granted an interview. You complete the interview, and then you get in. So that first summer we have off, and that is a great opportunity to get those 500 hours. It sounds like a lot, those hundreds of hours, but in reality, day after day, they all accumulate. And of course, what you complete in high school, anything in like senior year, for example, counts. And right now I work on the weekends, and it's 12-hour shifts, so day after day, they add up and you get the 500. The Drexel PA program does put you in really good hands. Professors are great, the classes prepare you, and you have really great peers and upperclassmen who can help guide you through the process. You are prepared to go into other programs. In fact, I know a lot of people who are not in the Bridge program. They elected to just do the 4-year health sciences major, and after that point, they would be able to proceed to PA school. They can apply anywhere they want. Even if you are in the accelerated Bridge program and you decide you want to just apply to other schools, you're able to opt out. The good thing about the Bridge program is you can always leave if you'd like. If you feel that something would just pulls you in more, you're able to do that. So it really, the Bridge program, it helps you do what you want to do. Unique aspects of the program, one thing by far is that we have co-op in junior year. So in addition to the classes, and this is, if you're in the Bridge program, this is after you've already applied, you're able to just start doing work hands-on. It could be patient care, it could be not, it could be research, it could be whatever you want, but that's part of the curriculum, and that's a good thing. The other thing about the Drexel PA program is that we focus on primary care. So once you are in PA school, you have clinical rotations. And Drexel, in addition to the 6 that we have, which is internal medicine, surgery, pediatric, women's health, emergency medicine, and behavioral health, we also have 2 primary care practicums, which are part of the curriculum, and it's a big thing for Drexel. I love my academic advisors. One in particular who I've had, she's really helped me develop my schedule into something that I want it to be. So with her help, I was able to mold it into something unique that works for me. So I added in a minor, I added in a little break before PA school, so I was able to have enough credits to really smush things together, get myself a break. So now I have that off, and I'm looking forward to just working and having fun and doing all these things before PA school. Professors are really nice here. I don't think I've met any professor that doesn't have office hours or isn't willing to help you out if you need help. You can schedule a Zoom. Now that we have Zoom, we can all do that. Or you can just go in person. But professors are really easy to talk to. They're really easy to get a hold of. Of course, you know, how we all are, we need to sometimes email, you advocate for yourselves, but they will always help you out, and I'm happy about that. I wanted to have a health services administration minor because of the ethics that's part of it. I love learning about medical ethics, how that relates to patient care, and how that relates to interactions among providers and patients. I think that's something that's really important to focus on for any provider. And so once I took the Intro to Ethics course, I just fell in love with it. And so I decided to pick it up as a minor. And the minor offers a variety of courses. Some are ethics-based, some are not. But since I can pick many of them are electives, I just choose the ethics one, and I'm learning a lot. Philly had a big part of my education. I'd like to bring you along the story of what I'm doing in the hospital, which is being a CNA, a certified nursing assistant. So this takes me back to winter break of freshman year. I wanted to get certified as a nursing assistant. So luckily for me, there was a place just in Center City. So I took the SEPTA there Monday through Friday over winter break, got my certification. Right after I got my certification, I started working in a long-term care facility, which is also just a 10-minute walk from my dorm last year. And I got 3 months of experience there, and now I work in a hospital, which is, again, a 10-minute walk. Something that really stood out to me was taking the honors classes here, and there's something that I just did not expect to find, but each term you have a different idea behind the honors classes. So this term, I'm taking a class where it's all about games and it's all about sports, and one of our assignments was to create a game, and it really just encouraged having fun with your friends and your peers, and I almost forgot it was an assignment, but these are the types of things we do here. We have fun while learning. The PA profession is really growing, and if you look at it and you like it and you want to become a PA, there are a couple routes you can take. Drexel's offers accelerated programs, so once you're in it, you can complete it in 5.25 years as opposed to 6.25. And even while you're in the track, you can always go out of it if you'd like. While you're at Drexel, you have so many opportunities as far as the hospitals go or anywhere else. We have a great health science building here. We have Philadelphia, which is a thing of its own. And you have amazing professors, you have amazing peers. So if you go to Drexel, you won't be making the wrong choice. If you want to have fun while learning and learn well and have access to a lot of opportunities, then come to Drexel.